Okay, so today we're diving into something pretty fascinating.
Oh, yeah.
It's this event, FaceInnovate 2025, and we've got the flyer right here in front of us. We're going to be talking all about that. And you know what really stood out to me right away? Dubai.
Oh, definitely.
Like that-
That's a big...
That's the location, right?
Yeah.
And I immediately thought of like luxury and, all the amazing architecture they have there.
Right, skyscrapers. And,
Yeah.
exactly, glitz and glam.
Yeah, but then you start reading this flyer and you realize, okay, Dubai is like becoming a hub for medical innovation.
Yeah, they're really trying to be on the cutting edge of all this stuff.
Yeah, and this event is like proof.
Definitely.
So FaceInnovate 2025, it's all about facial surgery and restoration.
Uh-huh.
But we're not talking, the basic stuff. This is like next level.
Yeah, this is like the future of facial surgery right here in this flyer.
Exactly.
Yeah.
And it's happening from November 21st to the 23rd in 2025. So
Okay.
still a little bit of time to maybe plan a trip.
Right.
But let's break down what they're actually going to be talking about there.
Yeah.
So day one, it sounds pretty intense.
Okay.
CMF trauma surgery.
Oh, wow. Yeah, that's...
And they highlight superior steel implant techniques.
So CMF, that's craniomaxillofacial, right?
Right, yeah. So we're talking about the skull, the face, the jaw,
Exactly.
and trauma. I mean, that could be anything from, a car accident to...
Yeah,
like-
any
like-
sort of injury to the face.
Yeah, and these surgeons, they have to be like master puzzle solvers, right?
Oh, absolutely. They're taking all these broken pieces and putting them back together.
And then you have these superior steel implants, which are like a whole other level.
Yeah, these are amazing for patients who maybe can't get traditional implants.
Oh, interesting. So it's like giving them another option.
Exactly, yeah. They're placed like right on the bone under this layer of tissue called the periosteum.
Okay.
And it really allows for reconstruction in cases where before, it might not have been possible.
Wow, that's really giving people a second chance at,
Yeah.
a normal life.
At having a complete face.
Yeah, it's amazing.
Yeah.
So day two shifts gears a little bit.
Okay.
It goes into oral cancer surgery and reconstruction.
Right?
And one thing that jumped out at me was free flap reconstruction.
Oh, yeah, that's super interesting.
So what exactly is that?
So basically, you're taking tissue from one part of the body,
Okay.
and you're moving it to another part.
Like a transplant?
Yeah, like a transplant. But you're also taking the blood supply with it.
Oh, wow.
So it's a very delicate procedure.
And they use this for like the mouth and jaw area.
Yeah, like say you have to remove part of the jaw because of cancer.
Uh-huh.
They can take tissue from the forearm, for example, and use it to reconstruct the jaw.
And it's not just like, cutting and pasting it there. You're actually creating a new blood supply to that area.
That's the key part. Yeah, the blood supply has to be there for the tissue to survive.
It's incredible. It's like they're almost like engineers or something.
Yeah, it's amazing what they can do.
Then there's also this mention of navigation and reconstruction.
Oh, yeah.
And this to me sounds like something out of a science fiction movie.
A little bit, yeah.
So break this down for me.
So imagine like a GPS for surgeons.
Okay.
They use these advanced imaging techniques and technology to basically guide the surgeon during the procedure.
So they can see exactly where they're going and...
Yeah, it's like pinpoint accuracy.
Wow.
Which is super important when you're dealing with such delicate structures in the face.
It's really reassuring to know that they have these tools available.
Oh, absolutely.
And it's not just about, the surgery itself, right?
Yeah.
The flyer also talks about sessions on managing complications.
Right.
And the importance of multidisciplinary care.
It's a whole team effort.
So it's not just the surgeon in the operating room.
No, you've got the anesthesiologist, the nurses, the radiologist,
Uh-huh.
maybe even a speech therapist or a physical therapist, depending on the situation.
Yeah, so it's really like this whole orchestra coming together to make sure the patient has the best possible outcome.
Exactly.
And I think that ties in really well with that image on the flyer.
Oh, yeah.
The one with the face and all the lines.
Yeah.
I mean, it's a beautiful image just from an aesthetic standpoint.
Yeah, it's very striking.
But it also feels very symbolic.
Yeah, I think it represents that interconnectedness that we were just talking about.
Yeah, like each line is a different specialty or a different technique, and they all come together to form this, this incredible whole.
It's like a web.
Yeah, exactly.
And it really highlights the importance of collaboration in this field.
So we've covered, what FaceInnovate is, where it's happening, and kind of the highlights of what they're going to be discussing.
Right.
But the big question is, why should anyone care?
Yeah, why is this important?
So think about it like this.
Okay.
We're talking about the future of facial reconstruction, injuries and illnesses. that, maybe 10, 20 years ago would have been considered untreatable.
Right.
Now there's hope
There's options.
because of these advancements.
And that's what's so exciting about this event.
Yeah, and that's what FaceInnovate is showcasing. It's this future where anything is possible.
It's pretty amazing.
And on that note, I think we have to leave our listeners with a question.
Oh, a good one.
With all this innovation happening in facial surgery and restoration, what ethical considerations do you think we need to be thinking about?
Ooh, that's a good one.
Yeah, it's something to ponder, right?
Definitely.
Because it's not just about what we can do,
Mm-hmm.
but also what we should do.
Right. What are the implications of all this?
Yeah. So if this has sparked your interest, I encourage you to do a little digging of your own.
Yeah. Look into some of these techniques.
Read up on the ethical debates.
There's a whole world out there.
There is, and it's constantly evolving.
That's for sure.
And that's the beauty of it. Right?
Yeah.
So keep exploring, keep learning, and we'll see you in the next deep dive.
Sounds good.
All right.
Until then,
Take care.
bye.
Bye.